Hello and welcome to this veterinary high performance how-to guide. Today, how to use mental rehearsal. My name is Patrick Pollock and I am a veterinary surgeon and specialist in large animal surgery. The purpose of the veterinary high performance how-to guides is to give you some tools and tricks to cover areas from how to perform at the highest level in whatever area you happen to be in, right through to some clinical tips and tricks which might be useful in the management of the cases which we veterinary surgeons see on a daily basis. Today, a discussion on the use of mental rehearsal, a technique to really optimize your performance in a high-stakes veterinary situation. So what is mental rehearsal? Well, mental rehearsal is nothing new. It's been used by lots of different groups of people for many years, really to optimize the outcome of the activity that they're performing. So whether it's armchair flying by pilots prior to taking off and setting off on a flight, whether it's being used by athletes to try and maximize the outcome of whatever athletic pursuit they're involved in, or musicians and even medical professionals really trying to improve patient safety and their own health and well-being. During a mental rehearsal, the person who's rehearsing essentially sits in a quiet place, gets rid of external stimuli, and imagines themselves going through the event or the procedure or practicing the skill in a very controlled and stepwise fashion. They focus on every single stage and the techniques that are required. So for example, if I was mentally rehearsing a surgical procedure, I would imagine the position of the drapes, the towel clamps, where the initial incision is made, and the anatomy and different structures that I might encounter on my way as I approach this technique. The idea is very much about doing it in real time, thinking about the other people who might be involved, the other team members, the other bits and pieces and resources that you'll require, and including all of the variables that would be in a real life event in the rehearsal. And at the end of the rehearsal, the performer has developed a mental model for the skill, the task, or the event, and can then reflect on that and how well it went, and always focusing on a positive outcome. Now, it's worth thinking about how our minds cognitively appraise any situation. So in this case, we're talking about veterinary high pressure situations and what happens to us in a high stakes event. What of course we all like to imagine happens in our brains is that in a nice, calm and controlled way, we stop, we take on board all of the information that's coming into our sensory system from around us. We assess the complexity of the situation that we're dealing with, and we compare that to our ability and our previous experiences. And then once we've done all of that, we make an informed and very reasoned judgment about how to proceed next. But in fact, something happens which is quite different to that. Your brain is programmed to ask 3 questions. How big is the challenge that's ahead of me? Do I personally have the resources to deal with that challenge? And what are the consequences of success or failure to me? And that's the critical part here. It's not about the success or the consequence of failure to the animal, the patient, the people around you, your workplace. Your brain's simply asking, what are the consequences to you? And in milliseconds, your prefrontal cortex and your brain will appraise that situation, comparing it to your previous experiences and the things that have happened or the things that you've seen before, the things that you know, and it will develop one of 2 possible options for how you are going to react. These are the 2 possible outcomes in every situation. Outcome 1 is that your brain says, well, this is tough, but you've seen this before. You have the resources, the abilities, the skills to complete this, and it's likely that you'll have a good outcome. And this will catapult you into the high performance zone of flow. And here you can see John Archie McMillan, the piping water skiing priest of the Hebrides, and he very much needs to be in flow in order to accomplish all of these complex tasks. Any one of these tasks is difficult. But in some situations, without you really saying that that's okay, your brain will look at the situation, decide that you do not have the resources, the skills, and the experiences to deal with it, and it will come up with an appraisal of threat. And remember that the appraisal of threat, which you feel, is related to the evolutionary brain, the early brain of human beings, which really deals with a threat situation as if your life is at risk, essentially. So all of the things that happen when your life is at risk, the release of cortisol and adrenaline, And you can't stop that from happening, and you will then be pushed into the low performance zone of frazzle. Your heart rate will increase over 100 or 120, your short-term memory will be shut down, your manual dexterity will reduce, and you become less able to do the things that you need to do. And my example of that is this little fracture fragment in the palmar or plantar part of the fetlock joint of the horse, the so-called Birkeland fragment. And these fragments are buried deep in the sesamoidean ligaments, and they are a challenge to remove. And I definitely had a mental block about dealing with this particular surgery, and I could almost talk myself into really not managing this surgery well. Now, if that happens to you and you're catapulted into the appraisal of threat and end up in the low performance zone of frazzle, you can recognize it and you can learn not to react, and you can learn to come up with a learned and measured and objective response which will help you deal with those high stakes situations. And in summary, really, mental rehearsal is a tool which allows us to make outcome 2 more likely. So why does it work? Well, the most amazing thing about mental rehearsal is that when you rehearse something in real time and in a controlled and measured way, your brain will chalk that down as a success. It will really think the situation was real, and it will say, yep, you've done this surgical procedure before. It was a success when you mentally rehearsed it. It's real as far as the brain's concerned, and therefore it's put down as a success. And you're more likely then to be able to complete it properly whenever you face it in real life. If you've mentally rehearsed things, it will speed up your decision to engage, to act, and it will improve the speed and the safety and the accuracy of the task that you're trying to execute. And if there are triggers as part of the situation that you're trying to rehearse, for example, like the arthroscopic surgery I described in the previous slide, then mental rehearsal will help to desensitize you, so you're much more prepared for that. And there are certainly performance benefits when you imagine yourself going through a routine or event on a number of occasions. So a really good tool in general, and also good for reflection after a high pressure event, and really helping you to prepare for predictable high stakes situations which involve a practical task execution. And that really will help us to change quite complex analytical tasks into more automatic, intuitive tasks, and more about that in just a moment. So we need to think a little bit about thinking. That's metacognition. There's a couple of ways that our brains make decisions. The first way is so-called analytical cognition, and we use that for complex, difficult, unfamiliar tasks. So performing a surgical procedure for the first time, for example, and that uses lots of our brain up, uses lots of our forebrains, lots of cognitive bandwidth, and we can't think about anything else. All of our working memory is committed, and these tasks are demanding and they're often slow. What we know is that we have another type of thinking, and that's automatic cognition, and that's where we've recognized something that we've done before. Our brain says, yep, I've been here before, I know how to do this, I'll get the best outcome if I do it this way, and it's fast, and we can do it with very little of our brain, so very little cognitive bandwidth. And the best example of a task which we can turn from an analytical task into an automatic task is driving. When we first learn to drive and we are concentrating on using our steering and thinking about gear changes and operating our various controls, it's very complex and it's slow, and we often struggle to do all those things together. Very quickly though, of course, we convert many of these things to an automatic task, and now when you drive around, you probably don't even think about where you're making the turns, turning on the indicators, changing gear, because those things happen automatically. And allowing us to change things from analytical to automatic makes a big difference. And we can drill tasks and use simulation and mental rehearsal to help us to change from analytical to automatic. Well, what are the benefits and evidence of mental rehearsal? Well, there's lots of really great information out there, but most importantly, all of the findings suggest that the brain doesn't differentiate between a vivid mental image and an actual physical experience. And so a successful mental rehearsal of an event is registered in our brains as a successful execution of the event. And that's the critical take-home message here. So we're turning complex analytical cognition skills for difficult or very technical skills into automatic, intuitive cognition, speeding up our response and freeing up our cognitive bandwidth to help us use that for other things in a high-stakes situation. In a mental rehearsal, of course, the performer controls the level of challenge, and it helps us to practice events that are difficult to practice in real life, so-called halo events, the high acuity, low occurrence event, that emergency that we don't see very often, but we really need to know what we're doing when it happens. And you can make that a very psychologically safe space to practice. Lots of good literature out there on the use of mental rehearsal, and a couple of nice examples, some from quite a long time ago, and one really excellent one which is worth a read, referring to basketball players, where basketball players, our basketball team, were split into 3 groups, with one group being allowed to spend more time practicing a particular maneuver, one group given time to mentally rehearse that maneuver, and one group given extra rest time. And the findings really broadly were that the group who practiced more actually practiced, they improved by around a quarter, and those who mentally rehearsed improved by a not dissimilar amount. So really you can get a good outcome. So the effect of mental rehearsal is really very well described. Now it's worth mentioning just a little bit about some neuroanatomy essentially, which helps us understand why mental rehearsal is so effective. And that is to mention the reticular activity system. And that is a network of neurons which is in the brainstem, which moves into other parts of the brain. So forward into the hypothalamus and back into the thalamus and in fact directly into the cortex. And its role really is to regulate wakefulness and sleep-wake transitions and mediate our behavior, and really to try and filter out all of the many bits of information that come at us and look for generalization. So it helps to find relevance amongst the vast amount of information that comes into our brains. When the reticular activity system, so the so-called RAS, kicks in, it in fact starts us overgeneralizing. And it takes what your inner voice says and it finds examples of that. So a good example of that would be back to my arthroscopic surgery that I find hard, and my inner voice says, yes, you always find this procedure difficult and you sometimes fail at it, and the RAS then finds examples from your memory of when you failed. It will say things like, no one ever sorts this problem, nobody ever manages this procedure, you always fail at this. And it can lead to a sense of impotence, and I guess overgeneralizing makes you think that there's really nothing you can do. And before long, you're into a zone of low self-efficacy and what is sometimes described as learned helplessness. Now, the psychologist Martin Seligman described the activity of the RAS as leading to this situation of overgeneralization, where you think the situation is pervasive and permanent and personal. And what you really need to do is start thinking about what is going right and when it went right, and change that situation to specific, temporary and external. You can get out of these things. And mental rehearsal essentially allows you to, I suppose, trick your RAS into thinking that you've done these things before, because it gives you examples where things went well and stops us from overgeneralizing and getting to that stage of where we think there's nothing we can do. So using positive affirmations in mental rehearsal, visualization, goal setting will help you to activate the reticular activating systems, really powerful filter in your court. So you can really think about when it went right. So lots of background there, but what's the most important thing? How do you do a mental rehearsal? Well, you set the scene, you set yourself in a nice comfortable place, you get rid of external stimuli. You might want to use a blindfold and perhaps some ear defenders to take away any external sounds, and then start thinking about the procedure that you want to practice. Here we are doing a laryngeal nerve graft, and this is a complex procedure, and mentally rehearsing this is a really useful thing to do. So set the scene and then visualize in real time, step by step, going through it, thinking about what happens, thinking about what you encounter, what are the aspects of the procedure that you encounter as you move along, and visualizing in real time, step by step, in a really positive way. Include all the variables that might be there, think about the other members of the team who might be there, and then at the end of the rehearsal, you're going to reflect on how it went and how well it went. There are a couple of things that go along well with mental rehearsal, and those are the cognitive aids, the checklists, and the kit. Pre-packed checked kit makes a big difference. Checklists can be used to make sure you haven't missed anything, and cognitive aids, like for example this rapid anesthesia induction protocol for a horse in a high-stakes situation, can be really useful. And BARTA, the British Animal Rescue and Trauma Association, have a great list of kits for both large animal and small animal emergencies, which can be used very effectively. So when we're training for high performance and future-proofing our teams, we're putting mental rehearsal front and center there to help us do that. We're going to start drilling tasks, and their future how-to guides will help you to do that. Thinking about using cognitive aids as a recipe in a simple way, practicing, converting demanding analytical processes to automatic, and freeing up bandwidth by cognitively offloading using those checklists and cognitive aids as we discussed. And then of course thinking about debriefing and really working to create a just culture in our area. And of course these things are good fun, and we are always trying to find time to have fun. The information presented here is for illustrative purposes only and is based on our views and opinions and not the opinions of anyone we may work or have worked for in any context. This series is not intended to provide veterinary advice, and if you are faced with an injured animal, you should seek advice of a veterinary professional in your jurisdiction. Lots of references, just a few of them here, and do feel free to read up and get in touch if you have any questions or thoughts or good examples of where you've used mental rehearsal. If you've enjoyed the material presented here, please consider sharing this on your network or subscribing to Veterinary High Performance or giving us a like or following us. Thank you very much for your time.